Hello everyone, this is Dr. Shawn Pourgol. I'm president of National University of Medical Sciences in this beautiful Spain. And today I want to speak with you why manual osteopaths should not bill extended health plan insurers for two or more services in the same day. And the reason is to avoid being blacklisted and delisted in Canada. The insurance companies in Canada has gone through some changes. Before, when a health professional commit fraud, they would get delisted and blacklisted from insurers. But now, fraud is not the only thing that can get them blacklisted. Many other situations can also get them blacklisted, and one of them includes billing for more than one services in the same day. As you know, 30% of my students are massage therapists, and they are also chiropractors and physiotherapists. Hello. And many other health professionals, and that are covered by insurance companies. So previously, many of them, when treating a patient, they would, for example, offer massage therapy and osteopathy and bill for both of them in the same day. Additionally, a number of manual osteopaths now work in rehabilitation clinic, in multidisciplinary clinics, and when the patient comes, patients have to get better faster. They have chiropractic, physiotherapy, and massage therapy and manual osteopathy at the same time. This practice is now frowned upon by the insurers, and they don't want that, and that can get manual osteopaths and the clinic that provide that kind of services blacklisted. Insurance companies prefer on the same day they just be billed for one health services. So we recommend to our students to just bill the insurers for one services. For example, manual osteopathy is covered up to $500 per year, and once that's finished, then manual osteopathy services can be stopped if the patient feels so. If not, they can continue, and then at that time, if patient needs such services, massage therapy, chiropractic, or physiotherapy, as per medical need of the patient, can be provided. But offering all that services together to patients is not recommended anymore, or it can get you blacklisted. As you know, I teach over 250 business lectures to my students, and that is why they have annual gross income of $150,000 per year, which is $60,000 more than what other manual osteopaths make in Canada. But making money is one thing. I also work a lot on make sure my students keep this money, and I want their money-making abilities to be protected. I always teach my students, do not joke with your money-making abilities, and this can affect them as well. So that is why we have so many number of lectures on ethics and the law as applies to manual osteopaths, because we want to ensure they are up to date with the policies of insurance companies, so they don't by mistake do something that can get them blacklisted. I've been teaching osteopathy for since 2010, over 10 years now, and thanks God, so far we did not even have one case of malpractice and insurance fraud or any type of malpractice against one of my students. I'm grateful for that, and I wish that stays like that forever. So please do not bill EHP insurers in Canada for more than one services. Provide just one type of services to them. This is not against the law. It is not a criminal matter. It is just a policy that insurers set, so the patients don't use so much of their benefits, and the benefit can last for a longer period. So it is not a criminality. It is not unethical. It's not against the many associations, but it is what the insurance companies wish, and we have to respect them because they're the one who are paying for the services, so we have to accept their wishes. Having said that, I'm grateful for insurance coverage of our alumni. As you know now, most insurance companies in Canada accept manual osteopathic care provided by my students, but I always teach my students to focus on cash patients. If more than 50% of your patients are insurance patients, you have a problem with your clinic and practice. Accept insurance cases, nothing wrong with that. But if you want to be wealthier, if you want to be protected, then focus more on cash patients. My students who focus on cash patients in general, they have they charge $140 per hour. The ones who focus on insurance coverage, they usually have hourly rates of hourly rates of $100 per hour. Because that's what the insurance companies pay, and they don't want the patients pay more than that. So focusing on cash patients make more money for you. Also, as there are so many patients, you have access to 100% of the population, while with insurance cases you have access only to 30% of the population who have extended health plan coverage through their work or private insurances. Also, research has shown that most patients who have insurance coverage, once their insurance runs out, they wait until the next year before seeking treatment again, while cash patients usually continue treatment until they fix the problem. So all in all, it's in your benefit to focus on cash patients. Yes, they are harder to obtain than insurance cases, but in the long term, it is better. I know many manual osteopaths who don't even accept insurance cases. So it is in your benefit. So please, if you do accept insurance cases, then you have to follow their policies to make sure you don't run afoul of them and that you don't get blacklisted. That's it for today. Wherever you are, I hope you have a happy, healthy, wealthy day. And thanks for watching this video. God bless. Namaste.